We had come to Calcutta for the purpose of checking out BC Roy Hospital, which is a hospital that had run into a great deal of scandal in the Indian media, largely because of a series of infant deaths that had occurred there quite tragically in 2011 and 2013. The reality of the situation was very different from what we had read about in newspapers. Here we found out that the hospital did not have the manpower to sufficiently take care of the number of patients that they had inherited. And the number of patients did not only come from Calcutta, they came from outside areas. And in those places they rely on things called peripheral hospitals. And in peripheral hospitals, it's actually the quality of care, the manpower, the equipment is much worse than even what's in the cities and places like Calcutta. When we visited the hospital in Bardwan, the Bardwan Medical College, we found beds, 124 beds in one pediatrics room, not separated by any curtains. The mattresses were covered in Chips Ahoy wrappers and Airheads candy wrappers. Walls had blood on them. It was not an ideal place for children and for newborns. Here the doctors told us that they did not have enough facilities, they did not have enough manpower to take care of the people in that area. Then we went to Borsal, which is an outpost, an even smaller outpost, which feeds off of Bardwan. And in Borsal, they had two doctors working for a population of 150,000 people. They had an operation table where that had been in an operation chamber that had been shut down for months, it appeared, and was covered in dust and cobwebs. And all these people are eventually sent into the cities, into places like BC Roy Hospital, where we originally visited. And that influx of infants who have to travel 2-3 hours to get to the hospital, there end up being too many patients, and they're in too poor condition for the doctors to actually take care of them. And that is the ultimate reason, more than negligence or anything else, why so many infants perished at that hospital. Okay, so we're here in Ahmedabad at Civil Hospital, which is the largest government hospital in India. We're investigating a series of schemes put in place by Modi's government to help people below poverty lines, one of which provides them with 2 lakhs insurance for any kind of medical mishaps or problems that they should have. And what we found is that while these schemes are indeed helping people, because there are a lot of people we've spoken to who would not be able to afford care otherwise, problems exist still with the infrastructure of the hospitals. And because of that, the care that they're getting is not necessarily optimal. We're in a town here called Janagoan, and we've just interviewed a gentleman named Mr. Balakrishna, who is a motorbike mechanic who has HIV/AIDS, and he was recently denied care from a government hospital to remove an abscess in his neck. Discrimination against HIV/AIDS patients in government hospitals is something that happens quite frequently in this area of Andhra Pradesh. Andhra Pradesh has the highest rate of HIV/AIDS in the entire country, and this area is the worst of it, largely because of a high numbers of prostitutes that work truckers and migrant workers in this area. And that's what makes these cases of discrimination against AIDS patients all the more tragic. Here you have a large population of AIDS patients, and they're not getting adequate care.